and also about vaccinations, about so much information, misinformation, new information coming up about these. So I thought that this session, I will just leave it open to the field for any of you to ask me any questions you want about anything. Basically, anything related to COVID, anything related to vaccinations, anything related to the Delta variant, the third wave, anything you would like to understand better. I'm the person here. And if you have any questions, it could be anything. Okay, anything which you heard, anything which you read, anything which is creating some sort of a burden in your mind because you're not able to understand it, please feel free. Let us have an open forum of discussion where we learn something out of this whole thing. What do you guys think about it?
That's perfect.
Good evening, Doc. This is Rajgopal here.
Hi, good evening.
Yeah, hi. Good evening. The first question I thought I should ask you is, how will I know if I have COVID if I don't have any symptoms? Just comes, gives me a light slap on the cheek and goes away. Since I'm vaccinated.
I'm just going to, how do I know that I have COVID after I've got vaccinated? If I get it, is it that? Am I rephrasing your question correctly?
More or less. I mean, if I have no symptoms other than a bit of fatigue or pain or some sensation, how will I know it?
Yeah.
No fever, nothing.
Yeah. Now, absolutely, that's a fantastic question. See, now if you, at this juncture in India, I am talking about August 3rd. Today is August 3rd?
Yes.
August 3rd. I am talking about August 3rd. See, on August 3rd, especially in Chennai, 28% of Chennai's population is vaccinated twice. And I believe that that is the number, but I also believe that it is primarily those who are educated who are vaccinated here. And you have to understand that now many studies are going on where they are saying that almost 60% of those who could get vaccinated, even who could get infected, even with the new variant, the amount of the people who are going to be asymptomatic is higher. And there is actually no way to identify other than doing an RT-PCR test if you need to be sure that you have COVID-19. Coming to the problem with this. The problem with this is information. I'm sure you have heard that even those who are vaccinated twice with Covaxin or Covishield can be carriers of the Delta variant. Okay, that is an information which has come out recently. And it has also been substantiated. So the one thing which you guys can do is to have a good index of suspicion. So if you have fatigue, if you have tiredness, and also in the second wave, the reduction of oxygen saturation was not an early symptom. It was actually a late symptom. So when the saturation started to fall, it started to fall very fast because this time in the second wave, chest symptoms, findings in the CT scan came way before oxygen saturation started to fall. So in the third wave, my point is, unless we keep watching out for what are the new changes which are happening in the third wave, I, for one, have a feeling that in Chennai, the third wave will not be as bad as people are saying it will be. But then again, in Florida, yesterday, they had almost 6,800 patients admitted, apparently, in the hospital, or they went to the emergency. So you just have to be prepared. We have to use this time to be prepared in case the third wave comes, and also remember that this virus is not becoming more severe. It is spreading to more people, more transmissible. So those who have comorbidities are getting affected more. So index of suspicion and also gathering information from trusted sources about what is happening clinically in your city, in your area. Because COVID-19 has different variations in different cities. Even the Delta variant in the US is not behaving like the Delta variant in India, because there are so many other confounding factors: health of the people, the medication they are on, the exercises they do, the food that they eat. It's just not easy to compartmentalize unless we keep upgrading ourselves, making ourselves fitter in such a way that even a small change of your lung capacity, your brain will acknowledge. A simple manner is, if you're somebody who is cycling 25 kilometers a day, trust me, if you have COVID and even if you're asymptomatic, you will not be able to do it. Things like that, raising your standard of life so that even asymptomatic, you will identify that you are not able to physically maintain the high standard which you have achieved in the past 6 months. That would be a really easy way to definitively identify if you have COVID or not. Have I answered your question, Rajgopal?
More or less, more or less.
Okay. Is there anything else I can clarify specifically?
I think let the other people also ask you some questions.
Yeah.
Yeah, I have a question, Doc. It's recently the Bharat Biotech, they are talking about the intranasal vaccination.
Yeah,
Yeah.
I'm waiting for it too.
Okay. It is a clinical
Yeah.
trial, and how long will
Yeah.
it take to come out to the market, Doc?
Oh, the reports are quite good. A few of my doctor friends have already volunteered. I could not do it because I've already taken 2 doses and a booster dose, anticipating the third wave. Otherwise, I would have definitely tried the intranasal one. See, the way it works is absorption from the mucus cells. So it's like if the vaccine is entering at a point where the virus also enters, sensitization of those cells which first encounter the COVID-19 will be much better. So I am hoping that the intranasal vaccine will work faster, better than the intramuscular ones. But studies have to uh, come out, and also it might be very helpful to use in younger kids. That's the advantage of intranasal vaccines. I'm thinking it should come out in 3 months time, by the I think October end or November, unless some of the trials go really wrong, which I don't expect, as they are already past the phase 1 and 2.
Right. Thank you, Doc.
Dr. Santosh, I have a question.
Hi. Yes.
I'm fortunate enough that even before this session, I've seen you in Facebook about a lot of your achievements and great things. Now, I just want a question related to ortho.
Yeah.
What do you think of rheumatoid arthritis, especially for females in mid 40s? And on an average, is there any data like the females in 40s age group, like how many percentage have recovered faster or
from rheumatoid arthritis?
Yeah, rheumatoid arthritis.
Okay. All right. Hey, thank you. This is something which is, yeah. Also, guys, anything with orthopedics also, please feel free to ask. That's actually my real baby, to be honest. Now, rheumatoid arthritis. So let's just break it into three. Okay. Rheuma, arth, and itis. Rheuma means is the Latin basis of rheumatism, which is some kind of self-infliction of our joints. Okay, that is only rheuma in olden terms. Then comes arth. Arth means nothing but joint, arth. and itis means inflammation. So basically, rheumatoid arthritis, if you just break down the name, is your body or your bone marrow. That is, the bone marrow is the source of any antibody or any cell which is produced. So if your bone marrow, instead of producing cells which reduce inflammation in your joints, help your joints to resupply the cells, and if it is not renewing the cells but creating an effect like your joint cells are enemies. See, it is rheumatoid arthritis is known as an autoimmune disease. Why is that? It is because generally, take you get septic arthritis. Again, septic means infection, arthritis, arth means joint, itis means inflammation. Inflammation is basically pain, change of color, warmth, swelling, and uh, loss of function because of infection or trauma or injury. Okay, infection and inflammation are not the same. So your body produces cells which go and attack your joints, and as long as your bone marrow is producing those cells, you will continue to have rheumatoid arthritis. Now, how can we overcome rheumatoid arthritis? The good news and the bad news with any autoimmune disease is that although there are physical and environmental triggers, it is mostly genetic. That's why you have people who have severe rheumatoid arthritis from 16 to 28, and afterwards it just stops. When that DNA expresses itself, the cells start to produce antibodies against the joints. So what anybody with rheumatoid arthritis has to think or hope is that at 48 or 45, the gene which causes antibody production against my joints has to stop expressing itself. There is a possibility of that happening. So the hope to hold on to is that one day suddenly I will just stop expressing that gene. If that doesn't happen, definitely exercises, continual exercises, at least 4 to 5 days a week, especially hydrotherapy, shows brilliant results. See, I run the post COVID rehab clinic, and do you know what is the greatest? 85% of anybody has fatigue. They tell me, I am tired, I am not sleepy, I just don't have energy. And that is the hardest thing to explain to anybody. Okay, it is primarily because COVID is creating a rheumatoid arthritis like scenario in the body. It is called post-viral arthralgia. After a virus attacks, suddenly your immune system is so confused that it produces antibodies, sometimes to its own joints. But with COVID, we expect it to be temporary because there is no genetic expression to it. So what do we do? So there is something, a problem which pre-exists, very similar to rheumatoid arthritis, which is also called chronic fatigue syndrome. So we use the same principles in this. The most important thing which I think India has to embrace is cognitive behavioral therapy. We have to start taking assistance of psychologists and psychiatrists. It is extremely important because I think we are going through a hell of a lot of mental stress. Is there any point in time where we don't have a worry now? There is something always at stake. And application of cognitive behavioral therapy techniques, yoga breathing exercises, okay, meditation. These are the 4 things which will help your mind control autoimmune production of cells, apart from all the repurposed medication we are giving. So, unless, see, whether we accept it or not, it's obvious that any physical illness has a great impact on your mind and the way you think, which means it is vice versa. So if you think right, control your mind right, the way you can control any disease, even if it is autoimmune, with all the advanced medical help which is available, becomes very, very high. I think in India we are struggling because we just do not use anything to assist our mind. We think that we are strong enough to know how to think without getting professional help. We are not even strong-willed to not eat after 7 o'clock when we want to lose weight. We really need help. And so if anything I would like to add for anybody who has long-term diseases is also start taking psychological and assistance from psychiatrists, because I have been treating pain all my life from 2005 onwards. And I have seen that when you are in pain for 6 months, the first thing which affects you is depression. You start to think, I am thirsty. Oh, I cannot go get that water. When you start to think cannot for everything, it's high time you start to take psychological help. All this said, what are the advances now for rheumatoid arthritis? So we have intravenous injections called biologicals. Okay, these are monoclonal antibodies, very similar to monoclonal antibodies for COVID-19. Okay, we have monoclonal antibodies for rheumatoid arthritis, which are quite effective. But again, what they do is they reduce the overall immune status of the patient. So how do we balance it? When you exercise, you stimulate your bone marrow to produce new cells. When you do weight training, you stimulate your bone marrow to produce new cells. You stimulate the stem cells in your muscles to produce new cells. So as you are using your biologicals, if you're also exercising and stimulating your bone marrow to produce good cells, you have very good recovery from rheumatoid arthritis. And to specifically treat any pain, especially for deformities of the hand, small joints, now we have targeted PRP injections, okay, platelet rich plasma injections, which are basically healing cells harvested from your own blood. And those are injected into those areas. As they are from your own cells, it reduces the inflammation which is caused by your antibodies in your rheumatoid sites, like your hand, your ankles, your neck, spine. Especially it is very efficient in those who are struggling with neck pain, low back pain, hip pain, and hand pain for rheumatoid arthritis. Because already you're on so many medications, for rheumatoid arthritis. I prescribe around 7 or so, because it is essential to reduce. Along with that, if you're taking painkillers for episodes of high pain, it creates a lot of effects in other organs of the body. So cognitive, behavioral, psychological assistance, medication, biologicals, and regenerative cells for specific areas. A combination of all this supplemented with exercise is how I have helped many patients. They've even started going to the gym now, but it has to be continually done for a period of at least 18 months for you to see a functional change.
Wonderful.
Sorry, this was a big lecture on rheumatoid arthritis.
It's a very holistic
answer. Orthopedics, this is what will happen. So, yeah.
Can I
Yeah.
ask a small
Can I go
clarification,
next?
doctor?
Please.
Ma'am, can I continue? Doctor, you
Yes,
were
sir.
talking about the post-COVID symptoms. See, one of the my granddaughter, who is 14 years,
Yeah.
suffered during the first and second week of May. But after her recovery, she's so tired and continuously sleeping. In the last 2 months, she lost her appetite, but keep on sleeping.
Okay.
But she's quite normal otherwise.
Yeah. So, like, you should ask your granddaughter, daughter,
Yeah,
sir.
my granddaughter.
Yeah, your granddaughter. I'm actually giving a lecture to IMA Palakkad about long COVID and how to treat all the symptoms.
Okay.
Tomorrow, Thursday at
Thursday.
8 o'clock. Okay, join in. It will be very, very useful because I cannot explain the whole thing here, but I will tell you how she should approach it, the strategy. Now, if you see, she got her COVID in May. So now it is 3 months. So first, what is long COVID or what is post-COVID sequelae? Persistence of any of the symptoms you had during the infection after 12 weeks of you getting the infection is only long COVID. Anything before that is just your immune system recovering. So she just got it on 1st and 2nd of May. So 1st and 2nd, June, July, August. So if she is having even one of the symptoms which she had during her infection after, like, even in the next 2 weeks, she qualifies as a long COVID person. So what is the first thing all of us who have relatives or friends who are experiencing symptoms after 12 weeks have to do? We have to avoid three things. First is check if there are any cardiopulmonary problems. That is, if there is an issue in the lung or the heart, because all of us are hearing of somebody young having a heart attack. Yes or no? All of us are hearing of it. So in cardiopulmonary, I'm just going to tell you one test all of you can do. It's called the 6-minute walk test. So how to see if your lung is improving? Sit down for some time, put in your pulse oximeter, check your oxygen saturation. Okay, say it is 97, write it down. Now, take your watch, set it for 6 minutes and walk at a slow, comfortable pace without increasing your respiratory rate. Okay, it shouldn't be hard for you. Slow, comfortable pace for 6 minutes. Come back, measure it again. If your oxygen saturation falls by more than 5, your lung and your heart have not yet restored back to normal, which means if you're doing some strain, your lungs and your heart are getting more inflamed than usual. That is one test to identify if you have fatigability or cardiopulmonary inflammation still. It's called the 6-minute walk test. Then coming to neurological, okay, the next thing all of us should be cautious about is neurological, because as professionals, COVID is causing, yes, it is causing strokes, but it is obvious. The one issue which it is causing is brain fog. People are actually forgetting things. People are not able to make decisions because they don't remember their experiences, and most of us now don't take decisions because of instinct. Its experience always comes into the picture. So if you're having brain fog, as I spoke earlier, psychologists have a lot of training exercises. You can retrain your brain to think right, make use of it. Then the third thing is um, clots. Yeah, clots are also very, very important. So we spoke about brain fog, cardiopulmonary, which is the test. Third is clots. So there is a test known as a D dimer. It's a very simple blood test. It's called D dimer. Do the blood test. D dimer can be elevated in a lot of things, okay? But if it is normal, you don't have to be worried. If it is elevated, something is still happening. You have a tendency to have a clotting issue. But if it is not elevated, you will be relieved. So, and I would also like to add, if any of your friends are still suffering from loss of smell or reduced smell, they have to start training their olfactory cells by smelling essential oils. It is very simple, and evidence is out that if you are smelling 4 essential oils for 15 seconds, 4 times a day, your smell improves. That is, it has improved in 60% of individuals in 3 months' time. So you can use like rose or lavender or coffee, anything which is there in essential oils. If you use 4 essential oils, okay, routinely, the improvement is around 40%. If you use 8, it increases to 56%.
Great.
So start smelling essential oils if you're having a loss of smell or reduced smell.
Thank you,
Doctor,
doctor. Thank you.
Yes.
Doctor, I'll go next.
Yes.
If one has to do an antibody test, what
Yes.
does one tell a lab? Because one fellow says, I'll do an antibody test and does one. The other fellow says you should do a spike protein test. So we don't know what is an antibody.
Why isn't your doctor writing you a prescription for your antibody tests? Okay. All right. So
Okay, I'm an RA patient.
Yeah.
So,
Okay. I'm a patient also. So
yeah.
see, in India, we just have 2 antibody kits. In the US, I sent my blood to the US to be assessed because I was working in the ICU every day for 8 weeks, and I had the blessing and opportunity of seeing and talking to 500 patients in the ICU during the second wave. So even though I was fully vaccinated, I wanted to know if I have some like weird mutation inside me. So I sent antibody tests for all the variants. We have antibody tests for all the variants in different parts of the world. But in India, in Chennai, we have 2 tests available. You can write it down. One test is antibody for, that is, it's called IgG. Put a capital I, a small g, and a big G. IgG for SARS-CoV-2 antibody. That is one. So it assesses the entire SARS-CoV-2 envelope, the envelope. The next thing is IgG for spike protein. Spike protein. Okay, these are the 2 which are available in most labs. Now, if you know somebody, then there is also a special kit for IgG for neutralization antibody. Now, antibodies are of many types. The antibody which shows us whether we have good protection. See, they say 80% won't get infected. 10% will get infected but not have any symptoms. 10% will get infected and also have symptoms. Only 3% will have severe symptoms. Why is that? It's because if you have good neutralizing antibodies. So neutralizing, there are antibodies which recognize the virus, like, okay, with all these cop shows and the drug shows like Narcos, that you have people who are outlookers, they stand and see. So you have antibodies which stand and see. Then you have antibodies which go and neutralize right away. So if you have good amount of neutralizing antibodies, then you won't even get infected. But in India, the kits are very few, so very few places are only doing it. The reason why we do those other antibodies is, if you have some antibody, that your immune system is being told that you have got infected. So your secondary immune response will definitely kick in. So if you have antibodies, the possibility of you being somebody who has an infection, who has got infected, but is not having any symptoms or has mild symptoms, is higher. That's why you should do these antibodies.
Sorry, not after your second vaccination to check if
Yeah,
antibody.
even after that you can do. See, if you do it after your second vaccination, also you can try to do all these three tests, because vaccinations are supposed to give you the neutralizing antibody also.
Yeah, true.
That's why it's the RNA strand, and it's taken inside that and put inside this to give us all this only. So it has to produce all this. It has to be better than natural infection.
But for RA patients, antibodies will be lesser. This is what the magazine or articles.
Yeah, but you see, um, uh, I, for one, have the advantage that most of my COVID patients have orthopedic issues, because uh, patients of mine who have been treating for orthopedics over the last 15, 17 years are the ones who I admit primarily. Okay, 50%, they are my patients. I've had patients who've been vaccinated, patients who've had psoriatic arthritis, rheumatoid arthritis. Many of them actually did not get the disease. They, after vaccination in the second wave, uh, many of my patients who had autoimmune diseases did not get admitted. They did not get very sick. So even though you might not have antibodies in the blood, do not think that your immune system is not capable. When push comes to shove, many times, whether you have some other autoimmune disease, see it, that only means that that part of your army is unable to differentiate between your cells and the foreign cells. Doesn't mean that every part of your army is blind.
Okay.
So just because you have an autoimmune problem, which is rheumatoid arthritis, that is only specific for your cartilage cells. Now, here we are talking about the T cells of the thymus and the B cells, which produce antibodies. Yes, there is a possibility that they might not work, but that's a statistical thing.
Okay.
You might work really, really well. So
Okay. Thank you.
don't
Thank
worry
you.
about it. Just wear your masks. It's very, very important. Trust me. If by touch wood, my team is made up of 13 people. Yes, all of us were vaccinated, but I was in the ICU for 3 hours every day or 4 hours every day. Okay, my nurses were in ICU for 12 hours. You know how they all protected themselves? Double masking, washing hands, because we cannot afford to do social distancing. I have to go put the stent and hear the patient's chest. How can I socially distance from that? I cannot. And they have to go give injections. They have to go keep the mask. Masking really, really helps. See, I don't have a mask business, or I don't want you to wear masks. I am talking out. It's damn uncomfortable. I'm not saying it's comfortable at all. I wear an N95, a big gown, and a respirator, because I go really close to really sick patients in the ICU, and I really want to live. So, but for you guys, simple, wear a double mask, a surgical mask, and a nice cloth mask matching to your clothes, and go out. Trust me, you guys will be okay.
Thank you.
It is important for us to look good in every aspect of life. So focus on your masks. Make them look good. They also help you. Yep. Is there anybody else, or have we had the questions for the session?
Doctor,
I have one question.
Yes.
Can you give me the linkage for that Palakkad IMA meeting?
Yes. Mr. Rajagopal, if you can just share my WhatsApp, I will send you the link to that.
I will do that, Santosh. I'll do that.
Thank you, sir. Thank
If you do that, I think any of you who are interested, please do, because there are very few proper informatorials, and I'm not, even though I'm heading the long COVID clinic at Chettinad, I'm not talking about personal experiences in that. I'm only talking about evidence from all over the world. What is happening, what has to be done, what we have to do in India, how we can make sure that we avoid long COVID from superimposing on the third wave. Imagine the headache which we have. Oh my God. It's crazy. Yeah.
Oh,
Yes,
any
I will
more questions?
send you guys the link.
I have one quick question.
Yes,
So,
please.
yeah, so, okay, I think you've explained a lot of technical parts. Simple question. So when I go for my morning jog, run, is it okay to wear a mask or not? I keep hearing yes and no. Okay, when I walk, I definitely wear it, but
Take it from another runner. You cannot run with a mask. You cannot run with a mask because, um, like, at some point of time, when you will need to take a breath of air in order to balance your volume, a mask will affect it. If you're somebody who's really fit and you're a runner, okay. See, I'm not a big runner. I do 3 kilometers at the beach every other days. I am not able to run with a mask. Okay, even though it's in the beach, because I have a feeling that my lung is not able to expand to capacity. Okay, so if you are a seasoned runner, you can run at 60% of your capacity with a mask. Don't do more than that. Find a place where you can run without a mask, man. Simple solution. Seriously, running with a mask is annoying. Cycling with the mask itself is annoying. It's rare. And see, after wearing the mask almost every day at work, and I'm thinking, how did I not think when I'm operating that it is that irritating? Because we have been wearing it in theaters from like forever, no? Yeah, but wearing it all the time is horrible. I feel really sad for all of us, actually, to be honest. Yeah.
true. Thank you. Thank you.
Doctor, in when
Yeah.
you're at work, is it N9? Do you wear do you have to wear N95 or a normal surgical mask and a cloth mask?
So you're asking in offices.
Offices, yes.
So the first thing is your office air conditioned? And
Yes.
what is the square footage you have per person working there? That is very, very important. And also, comorbidities have to be taken into consideration for everybody, and how many of them have been vaccinated twice. So what is see, there are a lot of things I can say, do this, okay? But practically, it does not work. So what I advise my friends who are working in closed office spaces is, first thing, make sure that you tell everybody, if you're sick, my friends, stay at home. That is the most important, whether you're wearing masks or not wearing masks or anything. If one person who is sick decides to come to a closed office space, so the first thing you have to do is you have to make sure that those who are sick do not volunteer to come to work. That said, if nobody who is sick is not coming to work, then your rules become easy. See, all the rules which have been said are thinking that there is one idiot who is going to break the rules and come. If everybody is vaccinated and if nobody is sick and you are having like enough space and cubicles in order to protect you at your station, you do not have to wear a mask, because that will help you wear a mask when you're talking. See, when we wear a mask, when we are far away from people, you know what we do when we first go to somebody? We have a tendency to remove the mask. It is psychological. So if you're not wearing a mask when you're alone, when you go to people, you can automatically think, okay, I just have to talk for like 2 minutes. Let me mask up. It is important. See, these small modifications are what will allow you to be a little more relaxed in a closed setting. If people are vaccinated and if nobody, and you're sure that if people are sick, they will stay at home, then you can relax masking when you're in your cubicle or in your room, and just mask when you talk to people in close quarters.
Do you have to wear N95 mask all the time at work?
I am a believer in surgical masks, first layer, cloth mask second layer, and wear really beautiful cloth masks.
N95 doesn't, you don't need N95.
Like I wear N95s only when I go to the ICU. I do not even wear N95s when I go for ward rounds. The reason is that you need an N95 when you are constantly breathing infected air. Okay, that's when you need an N95. That's why I told those three criteria: sick people not coming home to the office, vaccinated, and you have your own space. If you are in a space where you are not sure that you can maintain these three things, even then, if you are wearing a 3-ply surgical mask and a cloth mask on top of it, unless somebody comes and sneezes on your face and they are loaded with COVID-19, you will be okay. An N95 is really not necessary unless you're going to the hospital to see somebody. At this point of time, reserve it for that. Or if you're going to the supermarket or tea nagar, definitely you need an N95.
Just sorry, one last question is that if all the colleagues are just vaccinated once,
okay,
and waiting for the second one. So.
All right. So I have a beautiful story for this. Let's finish with this. Say you have moved to a place which is really beautiful. You have a big house, okay, but there is some problem with safety. So you talk to your friends, and your friends say, you know, the best way is to buy a really good guard dog. Best, buy 2. And you decide, okay, and you buy 2 beautiful 2-month-old vaccinated Doberman. When do you think you actually get protection from those dogs? As soon as you buy them, or does it take a year and a half for them to grow and for you to train them? So, my man, 2 vaccinations and 4 weeks, that's when you have your full protection. Otherwise, it's like a 4-month-old Doberman trying to protect you from robbers.
Thanks, Doctor. Thank you.
Yeah, you're welcome. All right, then.
Yeah,
I hope this was a useful session, because I personally feel on Zoom, you know, I do so many Zoom calls. I don't lecture. Every Zoom call is like this. Guys, let's talk. Because then it's easier to exchange information, because you're asking me something you want to know, you know, and it also keeps engagement. So thank you guys so much for playing.
Yes, thank you, Doctor. And we have, I think, Rotarian Mahindran, sir, if you're available, you can deliver the formal word of thanks.
Doctor, thank you very much for sparing your time and sharing your experience over many years with us. It's been wonderful hearing the do's and don'ts. Just one final question from my side.
Absolutely, please go ahead.
It is about 16 months since this COVID situation has come about. Do we still have any clarity?
Don't ask me the question.
Sorry?
Yeah.
So do we have any?
Don't ask me how it came into existence.
How it is being contaminated? How does it get transferred? That is the only query which is still not. I don't think there is clarity on that. Everybody is talking about various options, but there is no clarity how it is getting transferred.
Clarity on what? On transmission.
Sorry?
That is how infection is transmitted from one person to another?
Yes. If you could just give me some thoughts on that, that's okay. Anyway, thank you very much for sparing your time and talking to us.
Yeah, see, transmission is very simple. It enters through any of our orifices, actually. That is, it can enter through our eyes, it can enter through our nose, it can enter through our mouth, sometimes through our ears also. But as we have a lot of membranes there and there is no air exchange, it's slightly lower. It can also enter through our rectum. Also, there is a possibility that if somebody who had COVID-19 uses the same WC as another person, there is a possibility of it infecting. Now, the only new information which has come up after the last wave is that in the first wave, we were really scared that it spreads from surfaces. In the second wave, we have identified that only 3% of spread of all COVID spread happens through surfaces. So you really don't have to worry about cleaning up surfaces as much as we have to worry about wearing a mask and washing our hands. That is the only new information which has come up. Otherwise, yes, it does spread in air. It is airborne. It is definitely airborne. Yeah. So.
Okay. Thank you for the clarity. Yeah.
Oh, you're welcome. You're welcome.
And it's nice to have spend the time with you, hearing out on various issues of COVID. Thank you very much.
Yes. You're welcome, sir. Thank you, Rajagopal, for the invite, and for all of you. You guys were a brilliant audience. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you, doctor.
Bye.
Bye.
Bye-bye.
Leave.
Thank
Hi,
you all.
everyone. We can talk.
We can talk.
We can talk. We can
What?
talk.
What to talk?
மேடம் பேசுறதுக்கா சொல்லி கொடுக்கணும் நம்மளாம் நல்லா பேசுவோம் மேடம்
Dinner time. He just told, no, we have to have dinner at 7 o'clock.
Yeah, that's a very good point for all of us.
Yes, thanks to Dr. Kavita for coming and taking part in our speaker meeting.
I have one request, President.
Yeah.
We are recording this meeting, and
Yeah.
he has given us a lot of information. I don't know if we can assimilate all that.